So, good afternoon, everybody.
Hello, good afternoon.
Hello. Today, we're going to start the urinary system. So, let's see first the kidney. But before the exact slide, I just want to show some stuff related to the kidneys. So definitely the kidney is composed of cortical and medullary portions, as we covered it in the dissection room. So the cortical area is presented at the periphery, and we can find some invaginated portions of the cortex just between two pyramids called Bertini columns or Bertini's columns. And then the cortex is the place to represent mainly for the vascular loops filtering the blood called glomeruli. So these structures are presented mainly in the cortex, and here we have the medulla, and also when we are looking at the selection with small magnification, we can find some vessels at the cross-section. Oh, nice. So some lumens of the vessels related to the kidney. So you remember the exact distribution of the renal arteries. So we have segmental arteries, and they divide into interlobar arteries. They are located between the among the pyramids, and then the interlobar arteries at the base of the pyramids divide into arcuate arteries. So when we can observe some lumens related to the base of the pyramids, they are the arcuate arteries, and the interlobular vessels, the interlobular arteries, are located at the periphery, at the cortex. And also, when we are just zooming the cortical areas, we can find some these cord-like structures splitting eventually the cortical areas. These are the medullary rays. These are the masses of collecting tubules. And among the collecting tubules, we can find these circular structures. These are the glomeruli filtering the blood. And when we're talking about the cortex of the kidney, we usually can distinguish a small unit or a small cortical unit called cortical lobule, which is eventually located at both sides of one medullary ray. So eventually between two interlobular arteries called corticotubules. This is a histological unit of the kidney. The functional and smallest unit of the kidney are the nephrons. These are for the filtration and absorption. And there is another interpretation of the smaller units. That's the labyrinth, the cortical labyrinth, which is eventually an area just between two medullary rays. But the commonly used classification prefers the term of cortical lobule. So eventually the structural and functional unit of the kidney is the nephron. This is it eventually consists of a kind of corpuscular area that's called the renal corpuscle, which is just a vascular loop called glomerulus surrounded by a capsule that's called Bowman's capsule. So that's the renal corpuscle. This area filters blood, forming the first urine, also called ultrafiltratum. The average volume of the ultrafiltratum is 180, 190 liters per day. So it's amazing. And then we have a tubular system for the absorption of the 99% of this volume, because this tubular system absorbs the ions and and 99% of the water level eventually forming the approximately 1.5 or 180 milliliters, 800 milliliters urine. So eventually the 99% of the ultrafiltratum formed by the glomerulus absorbed by the tubular system. So the average is, so usually 1 milliliter urine is formed per minute in the nephrons. The tubular system consists of proximal tubules, proximal convoluted and proximal straight tubule. Then there is a hairpin called loop of Henle, and there is a distal tubule which represents first a straight part and then is a convoluted part when it joins to the collecting tubule that conveys the urine toward the tip of the papilla. And you remember when we are talking about medulla of the kidneys, they are the masses of the collecting tubules. And here we can see the lining epithelia of this. Yeah, so a glomerulus represents a vascular loop surrounded by a simple squamous epithelial lining. That's the parietal layer of the Bowman's capsule. And onto the surface, we have cells. So these nuclei are belonging to the podocytes. So podocytes are eventually big cells having long cytoplasmic processes called foot processes of the podocytes, and the ultrafiltratum just passing through among the long cytoplasmic processes of podocytes. These podocytes form the visceral layer of the Bowman's capsule. So there is a simple squamous here, and there are the podocytes. Yeah. And definitely at the vascular pole, called vascular pole, where the vessels enter into the Bowman's capsule, there is an efferent and afferent arteriole. The afferent arteriole has a larger lumen than the efferent one. That is the anatomical base of the higher intraglomerular pressure. So there is a higher pressure than the systemic one. So eventually, that's the exact reason of the filtration into the Bowman's capsule.
Dr. Katz,
yes?
What did you say the processes of the podocytes were called?
I haven't heard.
The podocytes, you
Yeah?
said they have big cytoplasmic processes called something.
Foot processes, foot.
Oh, okay, thank you.
Because they are really long, like the feet of somebody, so called foot process.
Okay, thank you.
You're welcome. Yeah, and there is another thing which is eventually a kind of physiological structure, physiological term called juxtaglomerular apparatus. Juxtaglomerular apparatus consists of 3 components. There is the macula densa. That is, macula densa is eventually an area where the distal tubule approaches the glomerulus, the vascular pole of the glomerulus, where we can find some cells in the distal tubular wall monitoring eventually the sodium concentration in the tubular fluid. And then we have juxtaglomerular cells. These are modified smooth muscle cells. They detect the eventually the stretch, the pressure in the vascular, the vessels, mainly in the afferent arteriole. So they are modified smooth muscle cells. And then we can observing extramesangial cells called extraglomerular mesangial cells. So the cells eventually really close to the macula densa and the vascular floor. These cells, they have many other functions. So they are able to phagocytose, they provide structural support, and definitely secrete some interleukins and transcriptional factors. So you should know these terms. So the juxtaglomerular apparatus consists of the macula densa, which is just a part, terminal part of the distal tubule, then juxtaglomerular cells. These cells are modified smooth muscle cells and sense eventually the pressure in the vascular wall. And extraglomerular mesangial cells, they are just the adjacent cells of the vascular pole and macula densa. Now,
Dr. Katz?
yes.
I'm sorry to interrupt, but I think Christina is in the waiting room to get into the class. She says
there's no waiting room.
Okay, it's like loading for her. I don't know if you can see it, or I can ask her to try to connect again.
But I haven't allowed the waiting room because it causes trouble.
Okay.
So there's no waiting room. And if, you know, many of them logged in, so join the meetings without meeting room. So, no, it's not, I think it's not.
I will ask her to try to do it again. Thank you.
You're welcome. Okay. Now, let's see now you can see the slide. So look at that. This darkly stained area is the cortex. This paler one, that's the medulla. This is the medulla. Here we have the portion of the Bertini's column, the invaginated cortical area, just between two renal pyramid. That's the tip of the pyramid called renal papilla, which eventually enters into this funnel-shaped minor calyx. So this is the place for the minor calyx. And this fat belongs to the renal sinus. That's the renal sinus. So let's see the cortical areas first. Look at that. So on that magnification, you can see these cord-like structures. These are the medullary rays. The medullary rays. And eventually, here we can see among them the glomeruli. So these are the glomeruli. And by the way, when we are looking at the vessels here, so it's beautifully seen. Here we have these lumens at the base of the pyramids. These are the arcuate, belong to the arcuate arteries. And then these lumens here, that is part of the one interlobular artery. So arcuate here, these are also arcuate, but just dividing the cortical areas, here we can find the lumens of the interlobular arteries. You know, so interlobular arteries here. Okay, then let's see the glomeruli, the structures of the glomeruli. This is a nice one here. Maybe it's better. Look at that. This is a typical Bowman's capsule. Here, there's a simple squamous epithelium just lining the parietal lamina of it. And onto the surface of this glomerulus, you see, here we can see the red blood cells in the vascular loops. So the nuclei of these lilac structures, these are belonging to the podocytes, having these food processes, just letting the ultrafiltratum into the cavity of Bowman's capsule. And that area where the efferent and efferent arterioles are entering and leaving the glomeruli called the vascular pole. This is the vascular pole, and the opposite side is called urinary pole. And really close to the vascular pole, here we have a lumen lined by a simple cuboidal lining epithelium. This is a distal tubule, so called macula densa. This is the macula densa here, and here these cells, these are the extra mesangial cells, but definitely we cannot see eventually the modified juxtaglomerular cells in the vascular wall. So these three types of structures are the part of the juxtaglomerular apparatus. And just looking at this view, we can see numerous lumens of tubular system, and they lined by simple cuboidal epithelium. But in the proximal tubules, we can find microvilli, a mass of microvilli. So these structures, having this messy appearance in their lumen, these are the proximal tubules. We are not able to identify which one is the straight, which one is the convoluted part of the proximal and distal structures. So looking at the histo slide, we can just identify which one is the distal and which one is the proximal. It's not a part of the identification. So these are the proximal tubules, and the well-defined lumens indicate the distal tubules. So the darkly stained nuclei having no brush border. So these are the distal. This is another distal tubules. So proximal and distal tubules are presented, and that distal tubule, which is really close to one glomerulus, to the vascular pole, that referred as macula densa. Okay. Then, just going down here, we can find vessels just following. So look at that. We can find vessels just following the collecting tubules. It's eventually just the counterparts for the eventually maintaining the special ionic milieu in the kidney. That's called vasa recta. We have a I think not there. We have a photo about this. So these vascular lines are belonging to the collecting tubules, and eventually they are really important for the maintaining the osmotic gradient, just maintaining the osmotic milieu as well. So it's a kind of countercurrent part of the kidney, of the medulla. So this is vasa recta, because we have straight vessels just going toward the papilla. And in the medulla, we can find numerous small lumens. These are mainly the lumens of the loop of Henle, the different parts of loop of Henle, and collecting tubules. So when we are just zoom in and look at that, so here we have a really small lumen. It's a short cuboidal, almost squamous. It's a short cuboidal. That's definitely part of a loop of Henle. That is also here, but it's a little bit thicker. But look at that. It's a story. This story is a little bit quite similar to the striated tubule, striated duct, and the intercalated duct in the glands. So these structures are eventually belong to the collecting tubule. So the nuclei are at the center, really circular, well presented. There is a tall cuboidal or columnar lining epithelium, while this and that, these are show cross-section of loop of Henle's. Definitely related to the loop of Henle, we can distinguish thin and thick segments, but it's also not part of the exam identifying these, but definitely it's an easy job, because this is a thin segment, while this and that may be this the part of the thick segments. Just depends on the exact thickness of the cytoplasm. So let's see another area. So here we have numerous lumens. So it's really nice. There is a sharp circular lumen having a nice big nuclei. So this is a collecting tubule, while this and these are the loops, belong to the loop of Henle's. So these are part of it, but this is a collecting tubule. That is another collecting. This is another collecting. It's a tangential section. This is its lumen there. Look at that. So here we can follow one collecting tubule here, and then the lateral sides. These are part of the loop of Henle's. That is another. It's a cross section of collecting. This is a cross section of loop of Henle again. And there is a vasa recta again, just following the collecting tubules. Again, so here we have the arcuate here at the base. Maybe this is the termination of one interlobar artery, because it seems it has a really huge lumen. Yeah, this is there is another nice area. So it's another, so this is obviously, that's the vein, that's the artery. Should magnify. So this is an artery, this is a vein. So this is the termination of the interlobar vessels, and then they divide, they give off the arcuate. So this at the base of the vessel, and then here, just going there, this is another aspect, that's an interlobular artery again. So just going there to the papilla, where we have only the terminations of the collecting tubules, and some of the loops are also presented. So the Henle loops there. So this is a thin segment here. There is another thin segment, definitely. The thick segments are at the higher parts. And at the tip of the papilla, we have a cuboidal epithelium, because the collecting tubules, the mass of the collecting tubules invaginate into the minor calyces, forming, showing eventually cuboidal epithelium. So this is the renal papilla, also called cribriform plate. Cribriform plate, like the cribriform plate of the ethmoid bone. So eventually having numerous holes of the collecting tubules conveying the urine into the minor calyces. And then when we follow the minor calyx, so this is the papilla, and going to the edge here, the epithelium is changing, and onto the surface of the here it becomes stratified. Look at it, onto the surface of the minor calyx. So here we can see these dome-shaped umbrella cells. So here we have the pear-shaped cells. The huge cells are the pear-shaped cells, then the middle layer, and here we have the basal cells. So this is lined by urothelium. The minor calyx is lined by urothelium, and the exact changing here at the tip of at the beginning of the minor calyx has a name. This is the fornix. This is the fornix, like the fornix in the brain. So this is the fornix where the epithelium changes. So from the tip of the papilla, the cuboidal epithelium is presented, and then in the lumen of the minor calyx we can find stratified epithelium, so which is really typical for the urinary system. So that's urothelium eventually. And then this area, you remember the funnel-shaped calyces surrounded by fat. Eventually, that's part of the middle layer, the middle capsule of the kidney called adipose capsule. So this is the adipocytes belonging to the middle layer, the adipose capsule. Okay. And then at the surface, here we have this is the outermost layer here. So eventually that's the third layer, the third capsule of the kidney. That's the renal capsule or fibrous capsule, because it's a dense, irregular connective tissue capsule surrounding it, having fibrocytes and collagen fibers and some of the connective tissue elements, but it's not loose, so it's a dense one because of the not so many gaps among the fibrocytes and collagen fibers. Okay, so that was the kidney. So again, the main principles. This is the cortical area, that's the darkly stained one. Here we have the medullary rays, that means collecting tubules just divide the cortical areas, and eventually the two sides of one. So the two sides of one medullary ray is referred as a cortical lobule. This is a cortical lobule or renal lobule. And just between two medullary rays, this area called labyrinth, cortical labyrinth. And in the glomeruli, I want to show a nice one here, maybe. So in the glomeruli, this is the glomerulus covered by Bowman's capsule with the parietal lamina and visceral lamina formed by podocytes. There is a portion of the distal tubule called macula densa, and now we are lucky because we can see the endothelial cells there. So this is, and sorry, the muscles forming the afferent and efferent tubular wall. So this is the vascular pole. It's, I'm sure, where the vessels enter into the glomerulus. And the opposite side is the urinary pole, where the duct system begins. And the irregular shape of shaped circular structure having these brush border inside, these are the proximal tubules. So the mass of proximal tubules are presented, and then we can find some tubules having no brush border. So this is a distal tubule, that is another one. So these are the distal tubules showing no brush border. Only the proximal tubules have brush border. Then going down, so just following the collecting tubules, we can find straight vessels. Here, look at that. Here we can see the exact course of the vessels indicated by the red blood cells. This is the vasa recta, which is eventually a really important physiological barrier or structure of the kidney. And then in the medulla, we can find numerous lumens of the collecting tubules and loops of the Henle tubules. So looking at this, this is definitely a loop of Henle. Here we have a collecting tubule, really nice, straight appearance of the cells. This is also a collecting tubule. Let's see another area, a little bit, maybe here as well. So collecting tubule loop of Henle. Look at that, how nice. This is a collecting, this is a loop of Henle. Loop of Henle, loop of Henle, loop of Henle. These are small ones. Yeah. Okay, we have another section from the kidney, the semithin. It's a toluid in blue section. Look at this first. That's for the cortical areas. So this is the glomerulus onto the surface. We have the nuclei of the podocytes. Here we have the parietal lamina of the Bowman's capsule. This is the vascular pole. Here we have some vessels, and that is a distal tubule. This is a distal tubule, so that's the macula densa. And look at that. You can compare it with the proximal tubule. These are proximal tubules everywhere. So the irregular shaped lumen, and there is something at the surface of the cells and in the lumen. So these are proximal tubule, and this is a distal tubule, which is a little bit brighter. And definitely the mesangial cells are there. Yeah. I told you, so we cannot see the modified smooth muscle cells in the efferent arterioles. They are unique cells. We can use immunocytochemistry to indicate their product, which is an enzyme called renin. So the modified smooth muscle cells secrete a material called renin. So renin, this is an enzyme secreted by these juxtaglomerular cells. Eventually, the renin raises the blood pressure. So when these modified cells, smooth muscle cells, sense the lower blood pressure, they initiated by the neighboring cells to secrete renin, and it's renin eventually triggers a cascade to raising the blood pressure, and because of the higher absorption of the water in the tubular system. Okay. Just want to make sure. So this is a distal. Here we have proximal, and distal tubules. And the other, I think, yeah, that's from the medulla. So here we can see the collecting tubules and loops of the Henle ducts. So these are the collecting tubules, while these are part of loop of Henle's. So again, collecting tubule, loop of Henle, loop of Henle, loop of Henle. Okay. Our next slide shows the ureter. That's the 77. Yeah. So this is the ureter, and here we can see the vessels in the tunica adventitia. So as a tubular structure, a luminal structure, we can distinguish different lumens, different layers of the wall. So the inner lining epithelium of the ureter represents umbrella cells at the top. So the dome-shaped cells are presented. So there is a stratified epithelial covering. The ureters lined by urothelium. You know, the urothelial covering just starts from the minor calyces, then major calyces, renal pelvis, ureter, and urinary bladder, where we can find urothelium. And in male, eventually we can find urothelium in the first 1-2 portions of the urethra, except the spongy part. And sometimes the prostatic urethra also represents the typical lining epithelium of the urethra, which is stratified columnar epithelium. So from the minor calyx to the prostatic part and membranous part of the urethra, we have urothelial covering. We have umbrella cells, pear-shaped cells. So these are the umbrella cells. You remember the huge cells having big cytoplasm. These are the pear-shaped cells. And at the bottom, we can find some small nuclei. These are belonging to the basal cells. Yeah. Look at that, it's really nice. So here we have the typical domes of the umbrella cells. You know, the umbrella cells are able to change their shape during the cytoskeletal because of the cytoskeletal rearrangement, and they're able to increase the capacity of the urinary bladder. But definitely it's not just because of the umbrella cells. There is a exact function of the muscles building up the wall of the bladder. So that's the lining epithelium. And then when we are looking at the structures underneath, there is a lamina propria. Here. Let's look at that. So lamina propria, really close to the basement membrane of the urothelium. We have some lymphoid elements, but a little bit down, we can find fibers, numerous coarse collagen fibers. So there is a relatively dense connective tissue. So this is the lamina propria. And this slide is quite typical to the gallbladder because it represents neither muscularis mucosae nor submucosa. So under the lamina propria, immediately the tunica muscularis or muscularis externa begins. This is it. And there is an inverse direction of the muscle layers, the smooth muscle layers. There is an inner longitudinal outer circular, and some parts of the ureter represent some oblique muscle fibers. So when we are looking at this, so this is definitely a longitudinal appearance of the smooth muscle cells. And here we can see the circular one. So the exact arrangement of the lumina, of the muscular layers changed than in the GI tract. And there, last layer of the wall. So that's the messy appearance, having numerous connective tissue fibers, adipose tissue, everything, vessels, definitely. So it's a loose connective tissue. You know, the ureters are retroperitoneal structures. So surrounded by connective tissue, there's no exact sharp border like in the intraperitoneal organs. But just checking this side, maybe it seems a straight one here. There is a really sharp border. So, you know, as a retroperitoneal structure, anteriorly, it may attaches to the, it can attach to the peritoneum. Therefore, one side of the ureter maybe represents serosa. but the majority, because of its location, represents adventitia because the ureters are retroperitoneal organs. Okay, now let's see the bladder. The exact slide of the bladder is number 8. Yeah, so on the slide we can find the lumen of the ureter as well. So this is the typical arrangement. So the umbrella cells, urothelium, that is the lamina propria, and then here we have the muscularis externa layer, and let's focus on the wall of the bladder. So beautifully seen, the exact dome-shaped umbrella cells. Here we have the pear-shaped cells. These are the pear-shaped cells, and at the bottom we can find the basal cells, and these are the I mean under the basal cells. This is the basement membrane under it. And then here we have a really vascular and cell-rich lamina propria. This is a lamina propria. So, and eventually, when we're talking about the bladder, the muscularis mucosae and the submucosa is eventually disarranged. So look at that, many gaps are presented here, there. Vessels are definitely we have. So this is the submucosa, which is a loose connective tissue. So there is a loose connective tissue, but it's not so thick as the loose connective tissue, the submucosa in the GI tract. So lamina propria, and when we are looking at the propria, maybe here we can see some fibers. So it's a disorganized muscularis mucosae we have. So here we have some fibers related to the muscularis mucosae. Maybe on that, you see it's a little bit better there. So this is the submucosa here, loose connective tissue. And then we have numerous fibers, smooth muscle fibers forming the muscularis externa. And the arrangement of the layers is quite similar to the ureter. So we have inner longitudinal. So, you know, when we are looking at the cross section of longitudinal section, the nuclei are at the center. We can see easily the cytoplasm of the cells. And then we have outer circular layer here. So the elongated spindle-shaped nuclei of the smooth muscles are indicating this. But also, sometimes we can find some oblique fibers, but usually we can see only these two main layers of the smooth muscle, the muscularis externa. And then this area here we have, this is the loose connective tissue representing numerous white adipose tissue and vessels. And we are checking the top of the, so here, the bladder. Here we can find some cells. These are mesothelial cells because you know the bladder is infraperitoneal. So some part of the bladder, I think here, we can see the mesothelial covering, or maybe we can. It seems here we have cells. So there is also a mesothelial attachment. So this is shows the that part of the bladder which covered by peritoneum. So you know the bladder is facing with the symphysis, but the superior and posterior portion covered by peritoneum. So eventually that section represents this attachment of the peritoneal covering here. and that side, here we have a lymphoid infiltration. It's quite normal, so it's not unusual. And then here we have a prominent cells. It may be a little infection because the mesothelial cells are squamous cells, but during the infections they become round shaped and cuboidal shaped. So yes, now it's getting thinner and thinner. So these are the mesothelial cells at the top of the surface. The bladder is infraperitoneal, structure. Okay. Yeah, so we have 3 practices and left, and we have only the male and female reproductive system. So I'm eventually I stop now. Do you have questions?
Hi, sir. Can you please show the muscula externa?
Here. This. That's the epithelium. That's the propria, submucosa, and muscularis externa.
So it's similar to the GI tract?
The arrangement and the name is similar, just the arrangement of the muscle fibers. So not inner circular and outer longitudinal, because in the urinary system, in the ureter as well, we have inner longitudinal and outer circular.
Okay, thank you.
Okay. And somewhere in the ureter we can find some oblique fibers as well. Welcome. Yeah. Any other question?
Dr. Katz, did we already go over the lungs and the larynx?
I haven't heard. Ben?
Did we study the lungs microscopically and the larynx?
Yes, I think we covered.
Okay, I probably need to refresh then.
Okay, so we have 3 practices left. So if you have trouble with it, we can revise them.
Okay, thank you.
So I'm gonna cover next week the male, then the female reproductive system, and the last practice we have only the placenta. So we have plenty of time to cover any other slides if you have trouble with them.
Do we have the heart?
No, just that small piece, but not the big one. Okay. Covered by the booklet. So definitely not the SA node and not typical posterior section of the heart wall. We have a small piece from the beginning of the semester when we covered the cardiac muscle.
Oh, okay.
Only those slides number, but are indicated by the exact schedule of the microscopic anatomy.
Okay.
Oh, I'm sorry.
No, yeah. Will there be a midterm number 2?
Yeah.
Will we get more information over or something?
Soon.
Oh, okay, perfect. Thank you.
But definitely the complete material from the after the first midterm. So the first covered the basic tissues and the internal organs histology covered by the second midterm.
But will it be in the last week, so week 14?
No, the 13th week.
Oh, okay, great, thank you.
As we scheduled originally in the weekly curriculum. But I'm sending a proper information soon, if we know the exact topic of the midterm, with the slides number.
Sir, I have a few stupid questions regarding the subject in general.
I haven't heard the end of your sentence.
Just about the general subject. In the mail you sent about the semifinal, it only mentioned page 116 of the calendar book, but 117 is also a syllabus of microscopic anatomy 1. So should we
Obviously, come on,
okay.
That's
Yes,
that's
okay. That was one of the stupid questions, sorry.
No, come on. Yes.
The histology manuals, I've been using the 2017 one, but is it different from the 2020 one on the online shop?
Always the online version is the proper one, because the booklet, the manual, sometimes use the old numbers, but just there is some mistakes in it. We also noticed.
Okay. And in the online publisher, there's a green practice manual booklet. I don't know if that's important for us or just the manual booklet. Okay.
No, it's not important for you. So the Nemes booklet is what is important for you, but it's just a manual. It's just a little help to cover the practices, but you should study from the textbook, the Junqueira or Pavlina.
All right, thank you so much.
You're welcome.
Excuse me, I just got kicked out and then I came in, so I don't know whether someone asked this or not, but regarding to tomorrow's macro class for EM18,
yes,
is it going to be held?
Yeah, I'm gonna be there. So I know it's a faculty day. It's not a compulsory practice, but I think the midterm is coming, so it would be a really good time to revise some stuff from the neuroanatomy. So I'm giving a macroscopic practice tomorrow, but it's not compulsory. It's not compulsory.
And Dr. Katz, regarding the embryology topic list in the calendar book, is it both internal organs for embryology and also the general embryology topics? Okay, thank you.
Yeah, you're welcome.
Sir, sorry, one more question about neuroanatomy. I'm not sure if we finished the telecephalon. Did we finish it or?
I think we finished. Have we finished? Telencephalon is nothing special. Telencephalon just covered the mid-sagittal section of the brain and the gyri at the surface.
Okay. And one more question, sorry. In the topic list that you sent for the midterm test for macroscopic, it says blood supply of the sinuses. Does it mean the drainage?
Dr. Katz, I couldn't hear you.
Sir, your audio is not working.
It looks like we lost him.
Great.
Yeah, we lost him. Sim, what did you ask?
Blood supply of
blood supply of what?
Blood supply of sinuses.
Of sinuses?
Yeah, I don't know what that means. I think you meant the drainage, because
maybe the pathway of the sinuses, like where what veins they drain to.
Yeah, but
there was a PowerPoint on it. It was, let me see.
I think it means just like the pathway, probably. I'm not sure.
Yeah,
like the duravenous sinuses, the subdural sinuses, like the superior sagittal sinus. Yeah.
With the arachnoid granules.
That's the CSF circulation, and the other one is just venous drainage. So I'm not sure what it means.
Just study both.
Yeah. Okay.
I watched his practices like twice each. It really, really helps.
Yeah, it does.
Okay, should we just go?
Yeah, I guess so.
All right. Bye, guys.
Okay. See you. Bye.